And speaking of the health chief, he now joins us on The Big Story. Welcome to the program, DOH Secretary Ted Herbosa.
Good evening, Seth. Good evening, Pauline, and good evening, Sean, and to all the televiewers tonight.
Before we talk about, well, AIDS, HIV, AIDS, and Mpox, when did you know that you were being retained by the president in his cabinet?
I just knew it around 5 p.m. during the live telecast of our executive secretary.
Oh, you weren't told directly.
No, I wasn't told directly. I was in the Senate the whole day. There was a committee on hearing at the Senate, and so I was present at the Senate the whole day, from morning to afternoon.
One of the things the executive secretary said was there was this air of uncertainty, and that's why he had to make that announcement. Did you feel that? Did you feel like,
Yes, of course.
edge?
No, that's right, Seth. No, in fact, all of us, when we were appointed, we knew we served at the pleasure of the president. Even now that our resignations have been rejected, we still serve at the pleasure of the president and can be fired anytime. So what I said when the rejection of the resignation came is that I'll work even harder to make sure that the goals of this president, who is very health focused, he really wants to fix the health system of the Philippines. I will doubly work harder so that we can deliver the goals of our president.
Did you feel that there were certain sectors who wanted someone else in your post, pushing for another appointee? Was there jockeying?
I was reading negative news articles about me, but I also read a lot of support from the medical community, the professional societies, the other health workers. So it was a balanced thing, So you're unsure. You're unsure what would happen. Yes.
You had it from both sides. Now let's go to the request that you want. Have you made it formal to the president that a national health emergency be declared?
Yes, in behalf of the Philippine National AIDS Council. So we have a Philippine National AIDS Council that's a collaboration of government agencies and civil society, nonprofit organizations that sit in a council, and I chair that. And we've been looking at the data since months back, even until October last year. And we had seen the continued rise of cases. It was like, in 2010, it was like 6 new cases a day. And then you heard your news clip, it's about 56 new cases a day. So that's a total of about 26,000 new cases last year, when in fact the people living with HIV in the country is only about 140,000. So that's a big jump. It's about a 500% increase, and many sectors in the international community are actually watching us and what we will do. So it's really very important that we stop this very fast transmission or increase of new cases. Otherwise, in about 5 more years, by 2030, we will have half a million people living with HIV in the Philippines. That's a lot. That's going to be a lot.
Do you expect the president to declare a health emergency?
I think I will get the support of the president, because it's the president that orders the other agencies of government. You see, as Secretary of Health, I cannot order DepEd to increase campaign against HIV or education of our children or HIV as a disease, and DSWD also, labor. So there are other agencies that can help me stave the rising cases of HIV in the country.
Okay, one of the figures, Secretary, that you guys pointed out was that a child as young as 12 years old was already infected, right? And the biggest rise is in this age group of 15 to 25, and that's kind of alarming. Talk us through how our data has changed. I mean, we have had this HIV problem as far back as a time of President GMA pa, no? Nung kumakalat siya sa mga BPO. Tell us how that has evolved into this younger subset of our demographic.
So my theory, Sean, is that we have a generation of kids that never saw the scourge of AIDS when it had no treatment. Because today, as of today, there is treatment as long as you're getting your ARV. You even have a patient that you showed. He's doing fine as long as he's taking his medications. So this is how the situation is today. You don't see people, dying of AIDS on the streets like it was when I was a young doctor. it was our COVID-19. That was the scare of that pandemic. But this generation of kids, the 15 years old, they never saw this. So I think that's why there's so much unprotected sex. Remember this Mpox? We discovered this increase when the Mpox started going around because we discovered spas and other habits, group sex and anonymous sex was happening in our younger population. So I think all these factors put together has led to this increase. So we need to fight it. We need to educate our young people on the use of condoms, abstinence, single partners rather than anonymous partners because we saw this with COVID, with monkeypox. We couldn't trace their contacts because they couldn't tell us who their sexual contacts were because they're anonymous.
But why is it unique to the Philippines? You don't see this happening to other countries?
The Philippines has been for a long time very low in the map of HIV. In fact, I think Thailand has more. They have millions living with HIV. They were the hotbed of HIV. Over that time, opposite tayo. We always had low numbers. We are less than 1% of the population with HIV. But this recent few years, it suddenly went on a jump. And I had a talk with Dr. Edsel Salvania, who's an HIV expert, infectious disease. And he's telling me there might be a mutation that we're looking at here with a faster spread and contagion. So it's really very important that we still practice. Well, it doesn't change anything. The precautions are the same. You do condom use, single partners, abstinence, all these things, and then testing. There's still apparently a stigma in the Philippines. So kids are afraid to get tested. And if they get tested and they're positive, they disappear. They get scared. They don't want to tell their parents. They don't want to get treatment. And then they come back to us with advanced HIV. So we really need to declare a kind of a public health emergency so that all hands on deck of the government, the civil society can help me really stave this problem, really top up and even lower the numbers immediately.
But Secretary, how accessible and affordable is treatment for HIV? Is it true that the Department of Health is offering free treatment for those?
Yes, Pauline. You can only get the antiretrovirals from government. That's what's unique about HIV. It's only the government, and it is paid for by PhilHealth. So you get them from treatment hubs. You cannot buy the treatment in the regular drugstore, even if you had a prescription, because it is provided. And the reason for that is we want to really make sure that people are receiving their medications and do not die from complications of HIV. Our problem is that some people disappear after they get tested. I think because they're too young, itong 15 to 25, they have to get parental consent to get treatment. So imagine 95% of my cases are men having sex with men.
Do you
Your
think that
son will tell the father, I got HIV and I got it from having sex with other boys. I think they get scared and they don't end up having treatment. So we need to change some of our consent laws. Maybe the doctors can start to provide the treatment if the child wants treatment.
How hard would that be to change the consent laws? I mean, that might be a little tricky, Secretary. Correct me if I'm wrong.
because they are minors?
Yeah.
That's tricky if there is no public health emergency. And that's one of the reasons why I think a public health emergency declaration can hasten this. Because remember, when we had COVID, the vaccine was approved in record time. The money to buy the vaccine was approved in record time. So there are things we can do in a state of public health emergency that would have gone very long.
Is the treatment expensive?
Yes, it's
Yes.
quite expensive. And there's even new treatment available in the horizon.
But prices
That's
have
just
come down.
injectable every 6 months. Because right now you drink so many tablets when you're taking the ARV, and we give a 1-month supply when they go to the treatment hub. They do a lot of tests to make sure your viral load is already untransmittable. And then
Secretary? Yeah, sorry
Yes.
but there are new treatments available, and I remember nung tinanggal yung USAID funding, this is what we were talking about, because a lot
Yes.
of these mga HIV patients rely on NGOs. Sometimes they're afraid to go to health centers, so they go to these NGOs, and they get
Correct.
the more modern kind of treatment.
Pero wala na yan.
Wala na ba yun? And can you
no, they're
guys
here.
offer it? Yeah.
Oh, let me correct you.
Okay.
The U.S. pulled out U.S. aid. Most of the money that was pulled out was TB money. So we still
Okay.
have this from Global Fund and from PEPFAR, the President's Emergency Response Plan against AIDS. So this is still available. We have yearly $7 million, and the experts are also still here. They've even created an office here. In fact, last March, because of our very high HIV rates, PEPFAR held their annual conference in Manila because of this rising cases. This was last March of this year. So very important that we continue to actually support the education of kids. So DepEd, I've talked to Secretary Sani Angara of this problem because these 15 years old are still in high school. And then we also have to talk to DSWD, also DOLE, because they also have measures in the workplace. Because some young people in the workplace, like the BPO that you mentioned, was identified before as
This is
cases
similar,
where there's transmission.
Secretary, to Mpox. The transmission is similar.
Yes, intimate and
So-
sexual contact is the transmission.
All right.
Not airborne. So you don't get HIV just by talking to someone
So
with HIV
if we can
or kissing.
shift to
It has to be sexual
Mpox,
contact.
we can shift to Mpox
Yes.
because again, in our neighbors, it's COVID. That's the worry. But in our case, it's Mpox.
No. Mpox is actually lower than last year. So it's not true that there is an increasing case of Mpox.
All right.
What is true is that our LGUs are now reporting every time they have Mpox cases in their area. That's actually very good to inform people about the disease. But our number of cases is lower from last year. So there is no increase in Mpox, but we do have Mpox. And the Mpox we have is clade 2. This is the self-limiting one. In fact, most of those reported have already become better or have been released from isolation. The Mpox that is dangerous is clade 1b in Africa. And that's why the vaccines are in Africa in your report. Because that's where the people are dying from Mpox.
So that-
Here,
Go
there
ahead,
are
Secretary.
deaths, but they were deaths related to people with HIV and Mpox. So they actually died of AIDS, not of the Mpox. The Mpox was just one of the diseases they got when their HIV got advanced.
So that's what's concerning here, Secretary. Walang available na vaccine for Mpox here in the Philippines. So is there a way that we can climb up the priority list? And by the way, congratulations on being appointed as the President of the World Health Association. Makakatulong po ba yun, Secretary, sa pag-lobby po natin to ask for more supplies for Mpox vaccines?
Because the clade we have, the type of Mpox we have is self-limiting and mild. It's not the one that you'd want to have a vaccination program. What has happened is that Mpox became my tracer disease for HIV. Why? Because the people, the key populations, consult a dermatologist or a doctor when all these ugly lesions come out of their face or arms. Then we also test them for HIV. 30% of our patients that had Mpox had HIV when tested for it. So it's become my tracer disease. And it's also become that educated me what are the sex practices of this population. Na-discover namin na may mga spa for men, merong online sex na anonymous, and then they just meet up in one place and they don't even know each other. Because we were trying to do contact tracing for the Mpox. So it's this behavior change that also needs to be corrected.
So-
what I call risky behavior.
Okay,
This
again-
needs to also be corrected.
It's 15 to 20 and mostly
Fine, yes.
men.
Yeah, 95%. The scary part says is that some of these men or boys may also be bisexual and may also have sex with women. So if I don't control this, it can spill over to women as well.
Secretary Herbosa, in the interest of trying to raise awareness with the public, if you are young and if you're watching right now and you're thinking you want to get yourself checked, but you're also scared of your mom and your dad, what are the available options for someone in that age group?
Okay, number one, there is a self-test kit that's now been approved by the FDA, so you can buy it in the drugstore. It's a self-test kit. The other thing is you can go to the treatment hub. If you're 16 and above, you don't need parental consent to be tested. Our law allows that. But you need parental consent once it's positive and you need treatment, because it's the PhilHealth of your parents we will use. And of course, even if you don't get consent, once you start treatment, they will see you're going to a treatment hub every month and getting the antiretroviral. So malalaman din yun.